Miss Charlene Kirk. She's a nurse, a registered nurse in Troup County. She comes in and does trainings for us. She also works with our CLS program, goes into the homes and does some monitoring and evaluations for us. Today she's here to train us on infection control, HIPPA, confidentiality. So everybody has a packet, and at the back of your packet at the end of today is a confidentiality statement that everybody needs to read and sign and get turned in before you leave today. And then I'll turn it over to Ms. Charlene and let her get started with our training.
All right, good afternoon. So today, like she said, we'll be talking about HIPPA, infection control, communicable diseases, and then she has the packet that she made up for you. Also included in the packet is some standards of conduct and code of ethical conduct that you will need to read over to. So getting started, HIPAA is Health Insurance Portability and Accountability Act. It's a universal set of privacy guidelines. It addresses the use and disclosure of individuals' health information by organizations subject to this national privacy rule. The HIPAA rules provide federal protection for patients' health information, and Carroll County Training Center has a policy and procedure in regards to HIPAA. And your copy of that is in this packet she gave you. You're required to read and sign it upon employment, and then she asked again today for you to sign the back sheet. Violation of HIPAA compliance or very expensive fines, and they're based on the level of negligence. They can range up to $50,000 per record or violation. And the highest settlement on record as of 2013, when I pulled these facts, was $5.55 million just for violating HIPAA for an organization. So here at the center, we deal with private medical information on a daily basis with our clients. And this information falls under HIPAA, and under law, we cannot, outside of our work, discuss, talk about, or disclose any confidential knowledge we have about our clients. With this being said, I'll discuss some of the issues we may face in regards to the health and safety of us and our clients. The first being infection control in our environment. Jody's provided us with the training center policy on this matter also, and this policy is in force to minimize our risk and the participants' risk to infection and to promote a safe working environment. It is our responsibility, all of us, to follow these practices. Standard or universal precautions, or a way to break the chain of transmission of infections, recognized and unrecognized sources within the facility. You treat everyone the same. If you're going to touch any bodily fluids or open wounds or anything, you have gloves on. You wash your hands. The number one infection control prevention is, of course, hand washing. And also you can use the alcohol sanitizer that's located throughout the facility. Contact with blood or bodily fluids, non-intact skin includes rashes and mucous membranes or potential sources of infection and should be treated as such. Here at the center, they provide disposable gloves for your use every time there is any potential exposure. Also, we have the first aid kits located many places throughout the facility, and I don't know if everyone's aware, there's a lot of good stuff in here, just besides first aid. The very bottom of this I saw, it's called PPE, Personal Protective Equipment. If there's a big pile of urine or diarrhea or something you've got to clean up, somebody has to clean it up. In here is a gown that you put on, disposable gloves, a shield for your face, and then a bag to put it all in once it's cleaned up. But that's very good that these are already here in the center, because if they weren't, I was going to suggest we get them. So I'm very glad that's available for us to use. So remember, wear your gloves and wash your hands after you remove the gloves. Anytime you must wipe a nose or a butt, or clean up any other body secretions. Communicable diseases are caused by germs passed from one human to another. The germ is either viral, bacterial, parasitic, or fungal. Methods of transmission include mucous membranes, which is any opening of the body, your eye, your nose, your mouth, and down below. Blood, breath, saliva, and sexual contact. Contaminated surfaces such as doorknobs, countertops, and equipment provide a medium for passing disease from one person to another. The 10 most common communicable diseases are the common cold, gastroenteritis, strep throat, pink eye, Fifth's disease, gonorrhea, hepatitis, whooping cough, rotavirus, and HIV and AIDS. Other communicable diseases include herpes, measles, meningitis, mumps, rubella, TB, chickenpox, and scabies. Influenza is spread with respiratory symptoms. So if any client or employee exhibits flu symptoms, they should stay at home. Cough, sneezing, and fever are the most common symptoms of the flu. Practicing good hand hygiene with soap and water and alcohol-based hand rubs are our first defense in any of these diseases. Another disease issue that could potentially come up is STDs, or sexually transmitted diseases. Chlamydia, gonorrhea, syphilis, primary and secondary, are diseases that are reportable to the CDC. Other sexually transmitted diseases that are not reportable are the human papillomavirus and herpes simplex and trichomonas. Many cases continue to go undiagnosed and unreported to this day. STDs are a health challenge facing the U.S. The CDC estimates 20 million new STDs occur every year in this country. Half are among the ages of 15 to 24. STD screening is critical. Prevention is the key. Abstinence, vaccinations, reduced number of partners, mutual monogamy, and use of condoms. The only way to contact STDs is sexual contact with an infected person. So the takeaway here today will be health information is protected and a breach could result in fines. Use of standard or universal precautions every time with every encounter helps reduce the risk of exposure to potentially infectious material to any of us. So if you have any questions or concerns, you can anytime call me or ask me, and then Jody is the policy officer here, and she could get you more information if you need it. So any questions? And I turn my phone down because every day at 3 o'clock, Andy calls constantly. And it looks like So be sure to read over your packet, sign your back page, give it to Jody, and take a look. If you haven't been in your first aid box, take a look in it, see what all's in that and available. Did you want to add anything?
Just wanted to, when we, lunchtime or in the halls or any other place, we need to be extremely mindful of discussing protected health information about any employee or any family, and especially any participant. Sometimes we do that not thinking about it, but it can get the agency in a lot of trouble if protected health information, and that means if they've got a communicable disease or anything else, that that we were to discuss with someone other than those authorized in the agency. It could be a big item issue for the agency under the HIPPA laws and liability for individuals. That's my takeaway on infection control.
And also be mindful when you're out in the community too, not to discuss it. Any other questions or concerns?
Do you have any specific rules about, like, from staff member to staff member? Just wondering, like, how exactly that works. Like, what would be a violation of HIPAA when it comes to sharing with other staff
Well,
members?
if you're involved with that client, taking care of that client, you need to know what's going on.
It's called a need to know clause.
Yeah, as long as, you
If
know.
there's a need for that person to know that.
That if it was another client here that had nothing to do with you and you never were involved with it, specific things about that client, you may not need to know. But if you're involved with the care and treatment.
It was just a general question. I was wondering.
Very good. Jody, anything else? Needs covering?
I don't have anything. Michael, Kimberly.
I mean, I just, a couple of weeks ago, I was on the phone with, a lady who's a physical therapist, and, she called up here on her own accord. And yes, she does work with that individual by service, but then was asking about their service plan and all their, specifics, and I wouldn't release any information. First of all, it was a random phone call, I don't know who this person
Yeah.
is on the other end of the line from,
So anytime another facility or organization wants information, that our client or their caregiver or parent or guardian can sign a release so that we can provide that information legally to another source. That just randomly, like you said.
But I mean, I think it happens more often. It's just kind of.
Yeah,
Now, we have an agreement, don't we, when people sign to be served here, like there's an emergency, we can give information to the
yes,
emergency
it shoots in
management.
there.
You know, that would,
Yeah, this was just on patient care, they come into the home once or twice a month.
And I think we included in the packet the standards of conduct and ethical conduct, because it's almost like we are one big happy family here. You have to still stay professional when you're discussing the clients. All right, if you've never looked in your box, you need to come look at it because it's available all over the center, and like I said, it's to provide protection. Also, the first aid stuff's in here, but I'm very glad the personal protective equipment is up there. So,
what's the best thing to do, an agency could do when there's a bug going around?
well, people with the bug need to stay home, and everybody needs to wash their hands and wipe down all the work surfaces.
Cough on each other?
And cough in your elbow. And if there's a client that comes in with coughing and snotty noses, they need to be put by themselves till they can be taken back home.
Do we have,
Usually they have to their own.
Yeah. That's number 7 for Andy. Hurry up, you got it.
Keep those routines.
All right, well, I enjoyed being here. give her this little, glad it was short, though. We got a lot of information in a short time.
Thank you. If y'all can, call your confidentiality statement on the front table.
See, I thought it would be all right, wouldn't run out.
Want me to stop it now?